When we look at historical records of the AIDS crisis in Canada, groups are missing. There is an echoing silence where Indigenous folks should be. This isn't accidental. It's a blatant archival gap rooted in systemic racism. Welcome back to Hear Queer and Maple Syrup, a look at queer Canadian history, an extension of my TikTok series. I'm Jacob, your host. Let's explore the AIDS crisis in Canada together. A brief disclaimer as we move through this episode. I need to start off by saying that I am a queer, white, cis man. My aim is to be respectful to Indigenous communities and Mi'kmaq folks in particular by speaking about the impacts of the AIDS crisis on their communities. I will be using the Truth and Reconciliation Commission report as a framework for the structure and language I use in this episode, specifically calls 18 and 19 on Indigenous healthcare from a historical perspective. This episode is being recorded in Mi'kma'ki, the unceded and ancestral territory of the Mi'kmaq people. I am a guest on this land and am very fortunate to have the privilege to record, work, and create art on this land. We are bound by the 1752 Peace and Friendship Treaty. We are all treaty people. Indigenous folks had a vastly different experience during the AIDS crisis across the country. While HIV and AIDS were spreading, Indigenous communities were also facing active genocide in the form of residential schools, in the form of the Indian Act, among others. Queer Indigenous folks had faced erasure since colonialization. Identities once widely accepted across many Indigenous cultures were erased when colonialists first arrived, including other gender identities. Pre-colonialism, various Indigenous nations across Turtle Island not only accepted, but revered those who fell outside the, quote, traditional binary of man and woman. It wasn't until colonialists arrived that gender diverse folks in those Indigenous nations had to hide. And they were taught to be ashamed of who they were. In an instant, gender diverse Indigenous folks went from positions of respect and reverence held for millennia to hiding in the shadows. The introduction and subsequent amendments of the Indian Act reinforced gender binaries, ignored matrilineal lines, and further erased Indigenous-specific gender identities outside of the colonialist binary. By the time the AIDS crisis arrived, the overall suppression of Indigenous folks by colonialist culture and values led to the complete oversight of not only the impact on their communities, but to broader, significant implications for who got access to treatment and who felt that a doctor's office was a safe place to go for help. This attempt at erasure was not a side effect. it was a policy goal. Queer Indigenous folks not only felt the suppression and attempts at erasure of Indigenous folks, but they also felt the active erasure of the queer community. It's no surprise to hear that they felt the walls closing in because they had walls on both sides that forced them into one of two unthinkable choices: be erased or conform to a colonialist and heteronormative society. Some chose a third option, which was to hide in plain sight. Safe-ish, even if it meant they couldn't seek treatment. This wasn't cowardice, but rather an act of courage through the calculation of safety. There would have likely been a back and forth between the federal and provincial levels as to who should provide treatment for Indigenous communities facing the AIDS crisis, because the Indian Act was a federal policy and healthcare is a provincial dossier. Indigenous folks across the country were left in a limbo, while various levels of government fought to place responsibility on a different level instead of coming together and helping people who needed supports during an incredibly difficult time. In the 1980s, when the AIDS crisis started, the data we have gives a false sense of security, because until 1990, and even after in many cases, the numbers of Mi'kmaq folks in Nova Scotia who had AIDS was very low. Not because of actual numbers, but because cases went underreported or they were hidden. And it was likely a mix of both. In 1990, Mi'kmaq communities started getting conferences and education around preventing the spread of HIV and AIDS. The numbers started turning more toward accurate reporting, even if there was still a significant, going on massive gap. The next year, in 1991, the Mi'kmaq AIDS Task Force was formed, becoming the only such organization in Atlantic Canada. It remains active today under a new name, Healing Our Nations, since May 2000. They serve 33 Indigenous communities across the 4 provinces, as well as off-reserve Indigenous folks through prevention and education. Those who worked on the task force held so much weight, especially in the early days, when the staff and volunteers would have been incredibly limited and serving such a vast number of people. In 1990, the 3rd annual Intertribal Native American First Nations Gay and Lesbian American Conference took place just outside of Winnipeg, Manitoba. During this important conference, a major event in queer Indigenous history, well, actually in Canadian history, took place. A reclamation of an important part of Indigenous history, the identity of Two-Spirit, a new name for an ancient identity that predated colonialization by millennia. And this wasn't just putting a name to it. It was a shift, a declaration of cultural sovereignty, a not so subtle jab at the Indian Act and the colonialist values forced on Indigenous peoples for generations. For Indigenous folks, the year 1990 was not an easy one, so reclaiming a key piece of history was not something that happened in isolation, and actually made it that much more important. The Kanesatake resistance in Oka, Quebec, happened at the same time as the conference. A significant armed conflict where Indigenous folks fought back against multiple levels of government when the decision was made without consultation to raise sacred ground in the Laurentides, Montreal region for a golf course. When we look at both of these acts of resistance and resilience by Indigenous folks, despite their differences in appearance, they paint a very powerful picture. Now, not every Indigenous culture has officially adopted Two-Spirit, including some Inuit cultures, as shown a few years ago by a Nunavut MLA who is Inuit herself, when she made a queerphobic remark about Two-Spirit folks. She did apologize and acknowledged that she had learned the meaning of the identity, revealing the links with an ancient Inuit gender identity that just doesn't have the same name as Two-Spirit. The simple act of naming at a time when people of any and all races and ethnicities, but particularly Indigenous folks, were erased and ignored because of their sexual orientation and gender identity, is so much more important than many people realize. It was an active dig at a system bent on erasing anyone who didn't fit the cisgender, white, heterosexual, and heteronormative mold that was predetermined. Unfortunately, we won't ever know the accurate numbers of queer Indigenous folks who had AIDS. Many likely died without treatment or diagnosis, either hidden in self-preservation or actively ignored. If they did receive care, they likely received minimal care from a cold system ingrained with institutional suppression and erasure of Indigenous folks. We talk so much about the isolation that people with AIDS faced, whether from their biological families or from the coldness of the healthcare system. But there were people who stepped in to fill those gaps. Next time, we'll dive into how lesbian and queer women stepped up to support those fighting with HIV and AIDS.